So thank you for joining North Kansas City Hospital's Long Hauler series. Today we're going to be listening to Stephanie Ramirez, and she is going to be talking about improving your memory after COVID-19. So Stephanie, I will leave it to you to do an introduction and to get started.
All right, thank you. As Shanna said, my name is Stephanie Ramirez. I am a speech language pathologist here at North Kansas City Hospital, and I work primarily in outpatient rehabilitation. So I see patients after they have gone home from the hospital, if they do need more therapy to help get them on track. Unfortunately, over the last 2 years, I have seen a fair number of patients following COVID-19 infection. So I've been able to see firsthand how this can affect the memory. And I hope today that I can offer you some insight and some tips and tricks to help you get that memory back. So before we start, it would be great if you could grab a piece of paper, because there's going to be some things that you might want to write down as we go along. Okay, so for today, I want to just talk about, first of all, what is memory, because I think understanding memory is kind of the first step in recovering that memory. Then we're going to talk about how COVID-19 affects the brain and therefore memory. And we're going to talk about how speech therapy can help regain memory function through restorative and adaptive interventions. And I'm going to try to leave some question and answer time at the end as well. So the first thing to remember is that your memory is a process. So there are 5 general steps for remembering something. So the first thing you have to think about is attention. So being able to pay attention to something long enough to have it stick in your brain. One of the things that people sometimes struggle with after COVID-19 is poor focus. So this could be impacted. The next step is encoding. So kind of looking at the pictures down below, you might think about it as talking into a microphone, having that recording on your camera. The next step is storage. So now you're taking that recording and you're burning it onto a CD. So you're storing it for later use. Next, we have consolidation. So that's filing that away, kind of into that long-term filing cabinet in your brain. And then finally, retrieval. So when it's time to get to that information later on, accessing it and finding that information that you need. So memory is quite a process. And when we think about memory, there's also different types of memory. So we often talk about immediate memory, meaning, you listen to something and you repeat it right back, like a phone number. Short-term memory, so maybe you're repeating it back or you're remembering something after a few minutes. Long-term memory, you're remembering something from months, weeks, years ago. Prospective memory is remembering to do something at a specific time. So, I might tell my husband, when you get home, could you start the oven at about 4 o'clock so it'll be ready by the time I get home to put dinner in. We also have different types of memory as far as how that information is received. So you have your verbal memory, listening to something and remembering it, visual memory, looking at something and remembering it, motor memory. So, they say it's like riding a bike, you never forget, because it's that motor memory. And then procedural memory, so going through your workday and doing those things that you're used to doing in a certain procedure. So it's kind of that ingrained memory. You might realize that you're at work and you don't even really remember the drive there because it was kind of just part of your procedural memory. So when we're thinking about types of memory, it's helpful because we can find out where the impairments are, and then we can also find out what your strengths are. So we'll play to those strengths to help you get that memory back. So this is where I want you to pull out your piece of paper, and I'm just going to give you a moment to go through these questions. And I want you to give yourself a 2 if you agree with this statement, a 1 if you partially agree with the statement, or a 0 if you disagree. So I often forget where I've put things in the house. I sometimes find a television story or plot of a book difficult to follow. I often forget words or find that they are on the tip of my tongue and can't quite find them. I often forget things and have to go back for them. Sometimes I forget things that I did the day before. I forget to do the things that I planned to do. I can tell somebody a story or a joke that I've told them before or ask the same question twice. I sometimes forget to tell people important messages. I find it difficult to learn a new skill or remembering instructions. And then last, I fail to recognize places or people's faces that I've seen before and should be familiar with. So when I first see people, a lot of times they really are worried, is this really a memory problem? Is this something I should be concerned about? And these are some questions that I ask them right off the bat. So everybody have their numbers and quickly add them together. If you gave yourself 8 out of 20 points, it does suggest that you may have poor memory and that you may benefit from using some compensatory strategies or some therapy. So keep calm. It's going to be okay. We have the tools to help. But this is just kind of something that you can give yourself a baseline in determining, do I have a memory problem or do I not? So moving on to COVID-19 and why that specifically results in changes in the brain. So first and foremost, we often see inflammation of the brain with a COVID-19 infection. COVID-19 leads to an activation of the immune system that can persist for months, and it really can affect those neural conditions or those neural connections rather in the brain. Also, your brain is constantly in this fight or flight mode when we're thinking about COVID-19. And that can affect brain function too, because you are in this fight or flight. Those higher level tasks that are not imperative to survival kind of get turned off and get less energy. I have seen several patients, and very young patients actually, who suffered a stroke following COVID-19 infection. That can certainly lead to changes in the brain. Hypoxic injury. So when we think about not enough oxygen getting to the brain, those olfactory cells. So one of the first symptoms of the original COVID-19, we all remember, was that loss of taste and loss of smell. So your smell, your olfactory system actually goes straight to the hippocampus, which is where your memory is in your brain. So once COVID-19 infiltrates the olfactory system, it has a direct pathway to your memory portion of your brain. Again, long-term stress, anxiety, depression, things that come along with being ill certainly can affect how your brain functions. And then treatment side effects of COVID-19, so things like sedation, intubation, and various medications can absolutely affect brain function. So this is just a picture here of your brain, the different parts of your brain. I have circled the olfactory bulb. That's where your smell is located. And you can see the pathway just around to the hippocampus. And that is where we primarily attribute some of your memory storage. There's also the amygdala, which is very important as well when we're thinking about memory and some of those higher level thinking tasks. So a lot of people ask me, am I alone? Am I the only one that's going through this? And the answer is no. So actually the prevalence is that greater than 40% of patients with COVID showed brain symptoms at the outset, and 20% of COVID-19 patients still have cognitive changes even weeks after they've recovered from COVID-19. Early studies don't show correlation between the severity of the disease and long hauler symptoms like brain fog. So you don't have to have a severe case where you're hospitalized to experience some of those memory changes. I looked up online some of the numbers. So it said that in Missouri, we are looking at about 167,000 people, and Kansas, 102,000 people who have some of these brain changes after COVID-19 infection. So main thing is you are not alone. This is something that a lot of people are dealing with. And when we think about long COVID, we also, look at a variety of symptoms, and you can see brain fog there is the second highest behind fatigue. So fatigue is the number one symptom. Brain fog was the second highest. And, when we think about brain fog, there is no specific test that the doctor can really give when we're talking about that. What they do go off of are your symptoms and are kind of what some of your complaints are when they are diagnosing this and potentially referring you for therapy. So when we think about the challenges short term, people with COVID might experience that brain fog, headaches, dizziness, fatigue, like I mentioned earlier, decreased attention or focus, poor executive function. So that means things like poor decision-making, problem-solving, planning. A lot of people experience mood changes and then memory loss. So the big question is, how does speech therapy play into that? So I like to tell people that my job as a speech therapist is treating everything from the neck up. So that includes memory, cognition, and thinking. As a speech pathologist, we do evaluations. So if someone comes in with concerns, we give an evaluation and we can give you a score, comparing you to other individuals in your age group to see if you fall in that normal range or not. And then based on your scores, we implement a treatment, and that treatment can be restorative. So meaning we exercise your brain to make it stronger, or adaptive, meaning we give you compensatory strategies to help you compensate for that memory problem. We also talk a lot about symptom management, managing some of those other things that I had mentioned on the previous slide. And then we also provide, of course, support, education, and then refer people on if they're needing additional help. So improving your memory after COVID-19, this is another great time to pull out your paper. We're looking at 4 steps to the pyramid. So kind of starting with healthy body down at the bottom to lay that foundation. Then we're moving into external strategies, which we'll talk about in a moment, as well as internal strategies, and then finally exercises that are going to help exercise your brain. Your brain is not a muscle, but it functions similarly to a muscle in that you can exercise it to keep it strong and sharp. So we'll talk a little bit about that. So number 1, laying that foundation, the mind-body connection. So your brain functions best when you take care of your body. So you're going to want to make sure that you're getting good nutrition, that you're getting good sleep. So, shooting for 8 hours a night. Exercise is very important. And sometimes after COVID-19, that can be difficult. So some of the strategies we've talked about is maybe breaking it up throughout the day, maybe 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes in the evening. So you get your 30 minutes a day. And then thinking about stress, anxiety, and depression as all kind of affecting that mind-body connection. So if you're dealing with those things, it's important to talk to your doctor and see what some of their recommendations are. If you're dealing with stress, anxiety, or depression, your brain is not going to function as well as it would be if those were managed. So once you feel like you're taking care of yourself, your body, the next step would be to use external strategies. So these are things that you do outside of your body to help you remember. So things like writing it down. You can have a person remind you, or maybe your cell phone, an alarm help remind you of something. Following a routine. So if you do the same thing at the same time every day, you're going to be more likely to continue to do that because it's part of your routine. If you didn't do it, it would feel different. It would feel weird. So sticking to that routine can make sure that you remember to do those important things like pay your bills, take your medicine, take out the trash. So kind of keeping that routine. And then finally, staying organized. So you keep things in consistent locations, so you're not losing things. You're trying to, keep a planner, a calendar, so that you can keep your appointments organized. Just making sure that you're taking as much of the burden off of your brain that you can, so that your brain can focus on those other things and not have to remember everything because you have some of it written down already. And I did do a healthy brain presentation previously, which you can find on our YouTube channel. That would definitely be something, if you wanted to check it out, it might give you even more ideas. So I just have a very short list of some examples, but you know, people use notebooks, Post-it notes, dry erase boards, calendars, watches, lists, even tape recorders, phones, pill boxes, timers, computers, address books. All of those would be considered external memory strategies. They're taking the burden off of your brain and helping you remember that information. If it's written down, you're going to have it forever, and you're not going to have to worry about remembering it. So those external memory strategies are good compensatory techniques to help with a memory that is not functioning as well as it used to. Now, internal memory strategies are things that you do inside your brain, inside your body, that help you remember things easier. And this is primarily where we spend the majority of our time within therapy, kind of focusing on different internal strategies that you can repeat and learn and start incorporating into your life. So number one, I think the main thing that I tell people is to pay attention. If we don't pay attention initially, it's going to be very difficult to recall something later. So when you're learning someone's name, actually listen to what they say. If you're parking your car in the parking lot, pay attention to what is around you so you can find it later. Also, breaking down larger amounts of information into smaller chunks makes it easier to remember. So instead of trying to remember an entire shopping list, maybe you break it down into the departments of the store that you need to visit. Repetition, rehearsal, kind of that self-talk can also be very effective. So I do this a lot when I leave the house to make sure, you know, I remember that, yes, I did close the garage door. I always worry about that. And so I will actually say out loud, you know, Stephanie, the garage door is closed. And just saying it out loud sometimes can help just ingrain that information. And then I am much less likely to have to turn around to check that I actually did shut the garage door. Making visual pictures. So maybe visualizing the route you want to take before you go somewhere in the car, visualizing the last place you saw something when you've misplaced it, can be very effective, especially if you are a visual person. Making mental associations, so kind of connecting things together in your mind. Maybe you make up a story, maybe you have an acronym or a song even that can connect that information together. So that's just a few of the things that we talk about within therapy. And I think all of them are worth a try. I tell people not every strategy is going to be effective for everyone just because we all learn differently, but it's definitely something that you can give it a go. And we're going to do that right now. So what I want you to do is draw 9 dots on your paper, just like that. 3 rows with 3 columns. Okay. And what I'm going to do on the next slide is show you a design. And I don't want you to draw it yet, but I want you to try to use one of those strategies to remember that design. So here we go. Okay, so here's your first design. So you might try to make a mental picture. You might try to talk it out, what you see. Okay, I see the line going almost all the way around, then it comes up, and then we have that little half mark there. And then when you think you've got it, I'm gonna take it away, and I want you to try to draw what you remember. I'll give you a few seconds. All right, how did you do? Did something work well? Did something didn't work well? Kind of ask yourself those questions because we're going to try it again. Ready? All right, 9 more dots. And I want you to try to remember this design here. So don't write it down, just the dots, and then use a strategy to help you remember. So I don't know about you, but I see the word yet. The big Y, E over on the left side, and then the T over on the right side. So that's a pretty good association. And then once you think you've got it, draw what you remember. All right, how'd you do? So that is an example of a cognitive exercise. A lot of times we utilize exercises that are going to help us learn or practice different strategies. And the one thing that I tell my patients is really important is just trying to get in the habit of doing something every day that's going to make your brain work. So try a variety of activities, learning something new. If you do the same thing every day, your brain isn't getting as stimulated as it would if you were doing something different. So if you like word searches, great, do word searches, but also do jigsaw puzzles and read a book and play along with a game show on TV. Maybe learn a new language or a musical instrument, something that's going to make you think. And again, like I said earlier, your brain is like a muscle, so you got to use it or lose it. Some of my favorite games are, things like Scattergories, Family Feud, Wheel of Fortune here, Scrabble. And the great thing is that it allows you to talk with others, usually conversation, and all of those things are really, really good for your brain. Also, computer games and apps on your phone can be great as well. And speaking of that, I have some here. There are several that do require, I believe, a subscription fee, but there are also some free ones. So what I would suggest is try the free ones first, decide if you like it, if you're actually using it, and then you can, maybe splurge to get the more advanced brain trainers. But again, even these, I would suggest doing something else. Don't just do these apps, because this is not like a one-stop shop that's going to help everything. You still need to give yourself that variety. Some ideas for if you're wanting to learn something new, things like gardening, cooking, staying up on current events, in moderation, building something, writing, and the library has a lot of awesome resources out there that I would encourage you to check out, and it's all free. When we think about working your memory, it could be something as simple as memorizing a poem or song lyrics, memorizing your shopping list, learning phone numbers or birthdays by heart, adding numbers without a calculator. Again, just really thinking about variety, words, numbers, and doing something that's going to make you think. So the main thing that I want to leave you with is the encouragement to be proactive. So this isn't something that you have to live with forever. You can follow up with your doctor and talk to them about this, and it is something that you can get help for. If you really want to feel like you're being proactive, you can sign up. There's a lot of research studies going on right now. There are support groups and specialty clinics, and then of course therapy. So speech therapy, what my profession is covered with a doctor's order. Most insurance is covered with a doctor's order, and that can come from any doctor, from a primary care doctor all the way to, neurology. But I would say if it's something where you know that things are just not right, they're not the same, being proactive and getting that process started early would be great, because then you could, have that much more time to really help train your brain and get it back to where it needs to be. And so I also want to leave you with some resources. So obviously the hospital, we're, at North Kansas City, we're here to help with education opportunities like this one. We have various therapies offered. There is a Kansas City Facebook group called Healing Hope KC. That is a support group for long haul COVID. There's also the Long COVID Alliance and Survivor Corps, all of which cater towards long COVID and giving, resources and help. So if you are dealing with this, I would definitely suggest checking them out as well. So with that, I will also leave you with my contact information. If you have any further questions, I'm available via phone or email. And I will open it up for questions now if there are any.
Thank you, Stephanie. Okay, so this is being recorded, but if you have any questions, please feel free to enter them in the chat or the Q&A. Stephanie, I really liked how you tied in the smell and how COVID has a direct course then to your memory.
Mm-hmm.
That really helped me a lot.
Yeah, well, you think about your smell, a lot of times when you smell something, it really elicits memories, right? So I know every time I smell coffee, I think of my grandma because she always drank coffee. And so when we think about smell and memory being closely related, that makes it make a little bit more sense. All right, I think we have.
Well, this is being recorded and it will be placed on YouTube later. I will also be sending out a link so that you can watch it as many times as you want or share it with others. So, all right.
All right.
I think we're good, Stephanie. Thank you so much for your time.
All right. Thanks, everyone. I hope everyone has a great day.
Bye.
Bye.